conditions. We have been invited him as a guest of honor, but due to some unknown reasons and unexpected conditions, so we could not felicitate him on that day. So on my request, again, due to the more and love and affection about on homeopathy and particularly about the association, Dr. T.J. Rao Garu accepted to be here on time by 4 o'clock, and he has arrived here today to witness the inaugurate the online oration. So I request Venugopal Gauri to follow further.
Good evening, everyone. Indeed, it's an honor to welcome one of the better-known homeopathic physicians of our country, Dr. Gopal Krishna Shanluji. Dr. Shanlu was born in Allahabad, and later he did his schooling from St. Anthony's School in Secunderabad. And later he also pursued his graduation in Lal Bahadur Shastri Medical College in Allahabad before he started to do his homeopathic medicine. And he's son of well-known homeopathic physicians of the times from Allahabad. And even while he was in homeopathic medical college, he lost his father, but kept himself active and focused to practice the system of medicine. And he has achieved many glories. He is well known amongst all medical fraternity in Allahabad and over the state of Uttar Pradesh also, as he was facing a lot of criticism as far as homeopathic medicine was concerned. And during the decade of the 1980s, he was very focused in countering all the criticism, and he ended up being the winner in convincing many doubtful practitioners of other systems of medicine. And he's also known to treat many untreatable or rare diseases. He has been successful and has been able to earn and garner a good name, and not only for his practice, also for our system of medicine. Indeed, it's an honor for us to have this great gentleman in this evening. His clinical discussion paper on osteogenesis imperfecta has been published in various research journals, and it has been well acclaimed and amongst many universities that hailed his achievements was one of University of Exeter in London, who have felicitated him honorably on that particular event. He's been also known in the subcontinent around us. He's been not only being a vivid practitioner, he has been having a research bent of mind and reached out all his homeopathic successes to the next generation of homeopaths. And when our association called him, he did not hesitate even for a second to say yes and join us this evening and share his experiences. I'm sure it's going to be a lot of utility value for all the practitioners and also the students of homeopathy. And it's a great honor to hear a gentleman who has completed 48 years of homeopathic practice. We welcome you, Dr. Shanglu, sir. The stage is yours.
Thank you. Thank you.
1 minute. First, before starting the oration, let me tell you something. And I invited Dr. Jitendra Rao Garu onto the stage. Please come and sit on the dais. I invite Naveen Garu to come and occupy the seat. And before we start the meeting, I request you all to pay our condolences to late Dr. N. Srinivasarao Garu, that a very close friend of mine and very lovely person and lively person. Unfortunately, during the middle of the time, suddenly passed away last year. It was very shocking news to all of us, and not only in this association, the entire India and even internationally also, there was a loss of his option. So today, actually, Dr. Srinivas Rao, with his own interest, he started this oration few decades back on the name of his grandfather, just to promote the quality education and quality clinical activities for the doctors and young doctors and other senior doctors. And every year, if he is was in city, he used to attend the function and wait till the last minute of the event. And that was a very happy moment and a great moment. And this, unfortunately, this year, for the last 2 years also, when we were conducting online, also Dr. Srinivas Rao joined online and accompanied us in the meeting. He's a very, ఒక మాటలో చెప్పాలంటే అతను చాలా నెమ్మదైన మనిషి, చాలా శాంత స్వభావుడు, చాలా మంచి అభిరుచులు ఉన్నవాడు. తర్వాత మంచి పని హోమియోపతి సిస్టమ్ కోసం కానీ, తర్వాత హోమియోపతి సిస్టమ్కి సంబంధించిన వ్యక్తులతో కానీ మంచి ర్యాపో పెట్టుకొని అందరినీ కూడా ఎవరు కూడా తనకు శత్రువులు అంటూ లేకుండా ఒక అజాత శత్రువులాగా మిగిలిన శ్రీనివాసరావు గారు ఈరోజు లేకపోవడం మనందరికీ చాలా బాధాకరం. ఆయన పేరును స్మరించుకొని మనం ఈరోజు వారి తాతగారి పేరు మీద మెమోరియల్ ఆరేషన్ కండక్ట్ చేయటం చాలా మాకు ఆనందమైనప్పటికీ, శ్రీనివాసరావు గారు లేని లోటు ఎప్పటికీ మేము కోల్పోయినట్టే. ఈ సందర్భంగా దీనికి కార్యక్రమానికి పిలిచిన వెంటనే హాజరైన శ్రీనివాసరావు గారి వైఫ్ శ్రీమతి సుధా శ్రీనివాసరావు గారు అండ్ నవీన్ గారు అండ్ రేణు గారు, వారి కుటుంబ సభ్యులందరికీ ధన్యవాదాలు. సో నౌ ఐ రిక్వెస్ట్ now, so let us felicitate our chief guest, because this is the time to felicitate. After that, we will have the meeting. And I request Dr. Gautam and Sai Shruti also. To accompany me while felicitating Dr. T.J. Rao, our guest today. జితేంద్రరావు గారి గురించి ఒక మాట చెప్పాలి. మానవ సేవయే మాధవ సేవ అన్న సూక్తిని సార్థకం చేయడంలో ముందున్నారు డాక్టర్ తనుగుల జితేంద్రరావు గారు. ఎంతో మందికి ఎన్నో సందర్భాల్లో ప్రత్యక్షంగా పరోక్షంగా సేవలు అందించిన ఆయన పాత్రికేయుల బాంధవునిగా నిలుస్తున్నారు. తెలంగాణ ఆల్ జర్నలిస్ట్ ఫెడరేషన్ అధ్యక్షుడిగా బాధ్యతలు చేపట్టిన మొదలు ఎన్నో సంస్కరణలు తీసుకొచ్చేందుకు కృషి చేస్తున్నారు. జర్నలిస్టుల సమస్యలపై ఎప్పటికప్పుడు చురుగ్గా స్పందిస్తూ వాటి పరిష్కారానికి విలువైన సూచనలు సలహాలు అందిస్తున్నారు. ఆర్థిక స్తోమత లేని వాళ్ళకు అండగా నిలుస్తూ భరోసా ఇస్తున్నారు. హెల్త్ పాలసీ అమలు చేయాలని ఆయన సంకల్పం మేరకు జర్నలిస్టులకు వీటిని అమలు చేయించి ఘనత తనుగులకు దక్కుతుందని చెప్పడంలో అతిశయోక్తి లేదు. కరోనా కాలంలో పేద మధ్యతరగతి పాత్రికేయ మిత్రులకు తన వంతు సహకారం అందిస్తూ ఆపద కాలంలో వారి కుటుంబాలకు వెన్నుదన్నుగా నిలిచిన తనుగుల జితేంద్రరావు వ్యక్తిత్వాన్ని మానవత్వానికి చిరునామాగా చెప్పవచ్చు. ఇటీవల జరిగిన కార్యవర్గ సమావేశంలో టీజేఎఫ్ ప్రధాన ఎజెండా జర్నలిస్టులకు యూనిఫామ్ కోడ్ అమలు చేయడం అని చెప్పిన తనుగుల ఆలోచన అనుసరణీయమని జర్నలిస్టులు భావించడం, ఆయన నిర్లక్ష్యాన్ని జర్నలిస్టు నిర్ణయాన్ని జర్నలిస్టు వర్గాలు గౌరవించడమే ఎన్నో సందర్భాల్లో సుదీర్ఘ సేవలు అందించిన తనుగుల జితేందర్ రావు పాత్రికేయ సమాజానికి జర్నలిస్ట్ రంగానికి ఓ రోల్ మోడల్. ఇటీవలే వీరికి సీనియర్ జర్నలిస్ట్ ప్రముఖ సీనియర్ జర్నలిస్ట్ అవార్డు లభించింది. చాలా సంతోషం సార్. ఓకే, థ్యాంక్ యూ. సో నౌ ఐ రిక్వెస్ట్ డాక్టర్ షాంగ్లు గారు టు initiate his discussion on the topic of osteogenesis imperfecta. Welcome, sir.
Okay, thank you. First, I pay my respect to your colleague who died unfortunately. And before I start my lecture, I must bow my head before my Adhyatmic Guru, Shri Dudhadhari Babaji Maharaj, and pay my respect to my late father, Dr. Parmeshwar Nath Changdu, who taught me fineness of homeopathy, and also to my beloved mother, Srimati Uma Shanglu, and my beloved wife, who is no more now, Srimati Meera Shanglu, who always helped me in my practice as well. Before I start my lecture, I want to give some tips to my brothers and sisters who are practicing homeopathy, that if we go and search uncommon peculiar symptoms in a patient, then our success is almost 100%. But when we fail to discover this uncommon and peculiar symptom, then the possibility of cure becomes less and less. So, we have been taught that we must search this uncommon and peculiar symptom if available in each and every case. I want to let you know a few cases by which I can explain what is uncommon and peculiar symptom. There was a case at Allahabad. He was having fever for a week. He had been under the treatment of known allopaths of Allahabad, but he was not being cured. And fortunately, he came to me, and when I asked his symptoms, I found that the patient is suffering from high fever, 104 degrees Fahrenheit. And when I asked about hers, he said, my tongue is dry, but I have no desire for water. I prescribed Pulsatilla 202 doses at 15 minutes interval, and the next morning he was all right. This, you must understand this thing, that epismel also has hustlessness during fever, but the temperature of Pulsatilla rises in the evening and temperature of epismel rises in the morning. This difference clearly let you know what medicine is to be given. So this is one of the case. I want to let you know that once upon a time I had an ulcer on my hind arm, on right hind arm, and there was oozing from it, and it was sticky. I thought about graphites, but when I thoroughly searched and found that the ulcer had a very peculiar look. It has black tips, eruptions at different places with black tips. I consulted Kent's this repertory and found only one medicine, that is Calibicromicum. I took Calibicromicum 202 doses, and it worked marvelously, and I was cured very soon. This is what we should know when we are practicing homeopathy that uncommon peculiar symptoms goes for 100 marks. You have not to let it down. You must remember that you have to search uncommon and peculiar symptoms while you are dealing a case. And if you get an uncommon and peculiar symptom, your success is almost 100%. There was a homeopath at Allahabad who he was senior. He was senior to me, but he did not practice as he was a wealthy man. So once he came to me with a boil on his leg, and he said that I am taking heap herself. Then I took Silesia, but none is working, and my this boil is very painful. It is not bursting it out. Then when I examined the patient, I found that the this boil was bluish in color. I said, doctor, you did not took lachesis. It is a case of lachesis. Lachesis 200 was given, and the result was marvelous. So we must understand what is to be seen in a patient, what is uncommon or what is peculiar in that case, and that peculiarity gives us the right medicine.
వీడియో
The
తీసేసాడు
choice,
ఆడియో ఉంటుంది
this gives a right medicine, and right medicine works marvelously. This shows how homeopathy works marvelously. So now I want to start my this lecture on osteogenesis imperfecta. As this this appears about the homeopathic cure for an incurable bone disease, osteogenesis imperfecta, and I have cured a few cases of this disease. The main thing in this disease is how it is diagnosed. We must learn how we diagnose that osteogenesis. It is a case of osteogenesis imperfecta. The patient, this disease is found in one child out of 1 lakh child. It is a rare disease. Second number is this, that when you will examine the sclera of the patient, which is a child, you will find that there is blueness in the sclera of the eye. This confirms the diagnosis of the disease. And the patient with a fine injury gets a lot of this fracture in bone. It may be in 10 parts, 5 parts, 4 parts, and but when it is plastered, yeah, this bone unite and give no bad result. But none of this child of this disease remained alive after puberty. But by the grace of God and by the service of homeopathy, a few cases have been cured through my hands, and I am going to narrate all those cases. Before I narrate those cases, I am going to give a little information about this disease. Summary of this. This appears is about the homeopathic cure for an incurable bone disease, osteogenesis imperfecta. 2 cases of this disease has been corrected by me, which were of congenital nature, and the treatment of the third patient is still continuing. It is about a few years back it was written. So osteogenesis imperfecta, a congenital abnormality of skeleton due to imperfect bone formation and associated with a peculiar blue color of the sclera of the eye. The bones are brittle and fracture with trivial injury. Osteoporosis is, some people talked me that it is a case of osteoporosis. Osteoporosis is a smaller thing. Osteoporosis is involved in this disease. It is a greater disease in which osteoporosis is involved. Osteoporosis is one of the symptoms of disease, and rarefaction of bone occurs. Introduction of the disease. The name of the disease itself defines it. The disease involves bones, and as the bone are unduly fragile and multiple fractures occur following trivial injuries. Progressive deformity occur because of the multiplicity of the fractures. A child prone to too many fractures may die before he acquires adult age. Histology and characteristics. Histologically, bones are normal and the fracture unite without any difficulty. The disease has autosomal dominant inheritance, and there is mesenchymal disorder characterized by increased fragility of bones and multiple fractures, blue sclera, and deafness, which occurs in late childhood. The disease is of two varieties, one is congenital and tarda. In congenital variety, the fractures occur during intrauterine life, and such children mostly die shortly after birth. Radiologically, the long bones and osteoporotic bent and slender, the bone ends may appear large and sometimes cystic. Treatment, allopathic treatment. As regards treatment is concerned, there is no curative treatment in allopathy for this disease. The fractured bones are made to unite by use of plaster, and deformity of long bones are minimized by use of an intramedullary nail. Homeopathic treatment. It is a matter of great pride to me and to all homeopath brothers and sisters that I have been able to cure osteogenesis imperfecta through homeopathy. As we all know that in homeopathic system of treatment, each case is thoroughly individualized, and uncommon and peculiar symptoms are carefully noted. Family history of the patient is also of utmost importance in such cases. Here I will prefer to narrate the cases of osteogenesis imperfecta which I have cured. Case 1. Name of the patient Sayyid Hassan Kamal of Allahabad. Age of at the time of admission 3 months. Date of admission 28/10/1992. Opinion of orthopedic surgeon. The patient was uh, examined by orthopedic surgeons at local SN Children Hospital and also at Sanjay Gandhi PGI Lucknow and at BHU Varanasi. Uh, all of them diagnosed the disease as osteogenesis imperfecta and declared in clear terms that it is incurable. Signs and symptoms of the patient. Bones easily get fractured from slightest cause. First fracture occurred at 1 month of age. Excessive perspiration on scalp during sleep, and also while he weeps, wets his pillow. He starts in sleep and weeps. Coldness of hands, especially of feet in the evening. Feverish at night. Appetite less, thus normal. Stool constipation, large, hard, and foul smelling stool. Mother took too many allopathic drugs during pregnancy to avoid abortion. Family history, asthma and diabetes in family. When the patient was brought to me, his both the legs and left upper arm were under plaster. Treatment. As the patient came through allopathic hands, I began treatment with Nux vomica. 28-10-92. Nux vomica 202 doses at 15 minutes interval was given on the first day at bedtime, and it was followed by Calcaria carb 200 two doses at 15 minutes interval the next day. Acute on 13-11-92. Acute coryza with cough and fever. Aconite nat 30 in distilled water every 3 hours relieved. 14-11-92. Diarrhea, loose, frothy, forcible, and foul smelling stools. Podophyllum 30 in distilled water every 3 hours relieved diarrhea. The 16-11-92. The patient had a fracture on right upper limb on 15-11-92 after a fall. Sulfur 32 doses at 15 minutes interval in the morning, followed by Calcaria carb 202 doses at 15 minutes interval the same evening. Calcaria carb 200 was repeated successively on 30-11-92, 3-1-93, 17-1-93, 31-1-93, and 15-93 with marvelous result. The patient had only one fracture on 15-11-92 during course of my treatment. Later on, he had no fracture even after an injury or after a fall. The patient was kept under observation for a few months, and finally on 10-5-93, Calcaria carb 1002 doses at 15 minutes interval was given. He is hale and hearty with no trace of the disease. Case number 2. Name of the patient, Kumari Avantika of Kanpur, UP. Age of the at the time of admission, 2 years and 3 months. Opinion of orthopedic surgeon, same as in case 1. Surgeons told that this disease can't be cured. Signs and symptoms of the patient. The disease was diagnosed when the patient had fracture for the first time after an injury at the age of 1 year and 3 months. It healed in normal course. Fracture occur only after an injury on other or on a fall. Sclera is bluish. Increased perspiration, especially on scalp, wets her pillow during sleep. Teeth erupted at 5 months of age and are slightly blackish. Had measles twice and diarrhea once. Appetite normal like sweets and also desires to take extra salt, thus less even in summers. Urine normal but involuntary urination during sleep occurs almost every night. Mind obstinate and irritable. Family, mother anemic, low BP, Grandmother had TB history. Treatment as the patient came from a distant place. Medicines were prescribed for 4 weeks. 24,994. Calcaria carb 202 doses at 15 minutes interval to be repeated every week for 3 weeks, followed by tuberculinum 202 doses at 15 minutes interval in the fourth week. 21,1094. Fracture of right femur occurred. Blueness of sclera is less marked. The same prescription was repeated. This time, tuberculinum was given in 1000 potency. 2011-94. A patient's father told me that uh, palms and soles of the patient remain hot. First part of her stool is hard and knotty, and there is extreme thirstlessness. Sulfur 202 doses in the second and third week, and pulsatilla 1000 in the fourth week. Better in general, no fracture occurred, increased perspiration on scalp during sleep, increased salivation during sleep, tooth look more blackish. Calcaria carb 1002 doses in the last week, followed by Merck salt 202 doses in the second, third, and fourth week were given. Marked improvement. The same prescription was repeated on 22 to 95 for 8 weeks, on 21 496 for 8 and for 4 weeks with perfect improvement. The patient's father is still keeping contact with me, though whom through whom one of his relation. This is written in the past, so it is written in 1995. So the language is not of today. The child, I could know that the patient is completely all right. No fracture has occurred till date, and that local orthopedic surgeon says that she is normal now. Case 3. Name of the patient, son of Mr. R.S. Rai. Age of the at the time of admission, 2 months. Opinion of allopathic surgeon, same as in the other 2 cases. Signs and symptoms. Bones fracture easily, excessive perspiration on the scalp, blue sclera. Treatment, Ruta 202 doses at 15 minutes interval were repeated every week, and Calcaria carb 200 was given in between. The patient is improving and no fracture has occurred since then. The treatment is still continuing. I have written it in the past, so the patient have been completely cured, and all these 3 cases have been cured by homeopathy through my hands. I want to let you know. Okay, thank you very much. Anything you want to know? Hello? Hello? Hello, doctor? Hello, doctor?
Dr. Shanglu,
Yes.
thank you so much, sir. It was an interesting explanation of those cases, sir. A few queries from our friends here. Like, do you look into any intercurrent remedies over a period of time in such a disease?
as you know that in homeopathy we prescribe on signs and symptoms of the patient. So because in these days I have not got any case of osteogenesis imperfecta, so I couldn't let you know what to prescribe other medicines which could be prescribed on in such cases, because we prescribe only on signs and symptoms. So if we will get some new symptoms, then definitely we will prescribe on those symptoms.
Sir, in general, otherwise, not necessarily this particular case,
Hmm.
you like to look at the influence of the miasm.
Yeah. Uh, this this uh, this type of difficult and incurable cases are mostly found in with syphilitic pain, as I told by the medicine which were indicated at that time. So I have not to give any deep acting medicine like syphilinum or medorinum, but I used sulfur because you know that Sora is present in each and every case. That's why I used sulfur, but I did not use syphilinum or medorinum.
Sir, you have used most of these remedies in potencies,
Hmm.
centesimal. And would you like to actually add any importance to the biochemic tissue salts in such a degenerative condition, sir? Would that
So,
help in assimilation?
I have used this salts, this calcarea phos 6x, ferrum phos 6x, kali phos 6x, but in limited cases where I needed it. But in general, I used 201,000 potency, and by the grace of God, in my 48 years of practice, I did not go higher 10 m or 50 m or cm. I got cure within 1,000 potency.
Great, sir. Sir, indeed, sir, on checking for Murphy's repertory after understanding that you are going to speak on this particular case, there are certain remedies like drops which help on the bone marrow, and probably they would have some sort of an influence on the bone assimilation also. Do you think such remedies stand any good uh, thing in such cases, sir?
But one thing you must understand, that if we have got any peculiar and uncommon symptom in a patient, we have not to search any other medicine. In suppose this case of osteogenesis imperfecta, if the patient has said, had come to me in summers, and he would have said that I feel too much this heat, my tongue remains dry, and I don't want to take water, I must have prescribed pulsatilla. So it is, you have to search uncommon and peculiar symptom. You have not to go that will pulsatilla work on bone or not. It is the uncommon symptom which makes the correct remedy and cures the patient if you have applied it.
Right, sir. Thank you, sir. Sometimes, sir, there are remedies, for example, pulsatilla, which can stand good for the uncommon peculiar symptoms of that particular patient. But would you think, sir, if when there is no seat of action of that particular remedy on the pathogenesis of the particular disease in concern, in such a scenario, should we rely more on some intercurrents, miasmatic influence, or some?
Definitely, definitely. If the patient is, if you, according to you, your thorough knowledge and your thorough investigation, you find that the correct medicine which is indicated is not working, then there is some wall standing before your medicine, and it is not allowing your medicine to work. And in such cases, that's why we homeopaths ask family history. I always ask family history. And if the patient had tuberculosis or syphilis or gonorrhea in the family, then we prescribe according to that this disease which he had in his family. If he is a patient, his family had tuberculosis, we prescribe tuberculinum as intercurrent medicine, and it helps the right medicine to work.
Great, sir. Thank you.
One case I just remembered. A case was came to me. He had fever only at night. He told me about this thing that in the last 5 years, whenever he had fever, it always came at night and remained at night, and in the morning it goes away. I prescribed syphilinum and he was cured. So such cases come before us, and when we prescribe according to the signs and symptoms of the disease, which is the beauty of homeopathy, then we get success. Is it okay?
Perfect. Thank you. So the question from Dr. Sunanda, she would like to ask you, what is the indication for Ruta in your advice?
Ruta,
Yeah.
Ruta, there was pain in bone, and this because we know that Ruta is a good medicine for this bone. I prescribed Ruta because calcarea carb is also acting on bones. So calcarea, in addition, I prescribed Ruta 30 for bone, and this simple seed thinking helped me, and I continued it.
Great. It's
There was no special symptom for, no uncommon or peculiar symptom for Ruta, but I prescribed it only because it works well on bone, and as calcarea carb was indicated, I was giving that. So I prescribed Ruta 30 in 30th potency, and I got good results, so I continued it.
great, sir. And indeed, it has a complementary action to Kalkereka, I guess, sir. And
Yes,
Dr.
yes.
has a query for you, sir. Why
Huh.
most of the time the medicine is repeated twice in a gap of 15 minutes? Is there any?
Yeah. This is my father used to give the second dose in after 2 hours, but I started after 15 minutes, and I found that it worked more beautifully than if it is repeated after 2 hours. The repetition is only a simple thinking of our mind. One, if a culprit comes to a daroga, and if he is a ordinary person, he gives a one slap and he explains everything what he has done. But a culprit who has done many ills in the past, when he is beaten many times, then he expresses his truth. So the when a disease is very chronic, we repeat it, the same correct medicine, we repeat it, it gives a good result. It doubles the action of that drug. It has been practically seen. That's why I am following it.
Great, sir. As Stuart Close would say, our medical is a bunch of thieves, and we need to find the right thief. And Dr. Shanglu says if the particular thief in question is expressing all the symptoms of the particular remedy at one point of time, well and good. If not, give him a little more dosage, he will come around. Thank you, sir. And there's one question from Dr. Nimit Urani. She is saying, are you not giving any maintenance?
Your voice is not coming correctly.
Uh, is this okay, sir?
Now it is better.
Yes. Dr. P.V. Durrani has a question for you, sir. She would like to know, would you use any maintenance medicines for such a scenario?
What type of medicines?
Maintenance dosage.
Ma- I could not understand. Your
Something to
voice is
be,
not correct.
something to be used in the long run.
What? What?
Uh, some medicine that can be used in on a regular basis.
Medicines are used only when there are symptoms of that medicine. If you have symptoms of brainia, you will give only brainia. You will not give calcaria carb. So the symptoms indicate medicine, and we prescribe if we are had the quality of recognizing the correctness of the medicine, then we will prescribe that medicine. So if there is a large amount of thirst for water, large amount of water, dryness of mouth, he is getting uh, trouble while walking, you will definitely think of brainia. If you are getting relief in walking, and your a few days back, a lady patient came to me and she said that I am suffering from leg pains for the last 1 year, and I took this allopathic drugs which gave me temporary relief. I asked the symptoms. She said that when I start walking, I get trouble. But as I walk a few steps, I get relief in pain. Then I asked that there are two medicines commonly used, Rustux and Pulsatilla. Then I asked her, then whether you get relief in pain by warmth or by cold. She said, but if I apply warmth on my leg, I get relief. So Rustux is clear. If I get relief by cold, then Pulsatilla is the other medicine. Pulsatilla gives relief by cold application. Rustux gives by hot application. Both are relieved by walking. In case of knee, I have just cured a knee in which this allopaths have asked the lady patient that you get your knee transplanted. She came to me and she had pain while walking. Otherwise, she had no pain. But when she starts walking and as she walks, she gets pain. Warmth relieved. I used Chelidonium 200 and she was completely cured within a few months.
Wonderful.
No kidney transplant, this knee transplant. So these symptoms guide us the correct medicine. And if correct medicine is used, then there is no failure, no failure.
Right, sir. Thank you, sir. There's one more question. Do you think there is a better prognosis when we use our homeopathic medication along with some modern medicine in such conditions?
I say if homeopathy is sufficient to cure a patient, what is the use of using other medicine? In my practice, in cases of cancer, where the patient has been advised that he will not survive, in that cases, I allow the patient and his family members that you can use any medicine. We do our job, but I take care that the other medicine is given after half or 1 hour after my medicine. In such critical cases of cancer, where the patient has been told by the allopath that he will not survive. In such cases, we give other pathy also the chance. If something does miracle, we accept it.
Okay, sir. And sir, what do you think could be the role of calcium supplementation, vitamin D3 supplementation, and vitamin K supplementation, especially in such cases of osteogenesis imperfect?
Yeah, calcarea for 6x. This is yeah, it is in potentized form. So if you use it in 6x potency or 12x potency, it goes on supplements the need of calcium. But remember, the cause always cures. If you have calcarea carb patient, increased perspiration on scalp during sleep, and this type of symptoms are there, then calcarea carb will generate this absorb calcium from your food and give you the best result. Calcium 6x potency, which is used as supplement, this will give a little relief if the main medicine is working, because that medicine will just take out of your food and apply to your physique. Is it okay?
Fine. Thank you so much. One last question.
Hmm.
One doctor wants to ask, what's your experience with back remedies?
Okay. I could not hear it. Your voice was not clear.
What's your experience with back remedies, sir?
What experience about which medicine?
Back remedies.
I could not understand.
BSCH, batch flower remedies, sir.
I have no experience of those medicines.
Okay, fine. Thank you so much, sir. It was indeed a great listening for all of us, great learning for all of us. I'm sure the homeopathic fraternity who have attended this evening have the same thing to say. And indeed, it's also the time to honor our speaker. And we request the sponsor of today's evening, Dr. Mrs. Sudhaji, to come on stage. I request Dr. Sai Shruti to come on stage, and I want her to share the screen where she will, Madam Sudha will be presenting a certificate of appreciation to our speaker online.
Good evening, everyone. Good evening, everyone. It's an honor to be here, uh, co-moderating Dr. Late Senior Srinivasarao, my husband, grandfather, and the great work, ongoing work that has been being continued year after year. Really applaud all of you for this great work.
ये हो गया है खत्म। इन्होंने सर्टिफिकेट ऑफ
Sir, we'll also be mailing that to you, sir. Thank you so much, Dr. Shani, sir, for spending this evening with us. And we also thank all the fraternities that have been online and also offline to attend this interesting, useful webinar. We recognize the presence of seniors like uh, Dr. Sachin Patil, Dr. Naeem, who have been with us this evening, Dr. Ashok Pandit, sir, who, one of the senior most homeopaths in the state of Karnataka, who have come to this meeting. And I request Dr. Gautam to present vote of thanks.
Good evening, friends. I would like to thank each and everyone who has been the part of this oration today, especially, firstly, today's sponsors, Sri Nyapati Venkata Srinivasa Rao Memorial Oration, family of our dear sir. Thank you for being part of the association. It's always a pleasure to be associated with you. Sir has always been an inspiration for the youngsters like us, ma'am. He was, and he will always be an inspiration for the generations. I would like to thank this. I would like to thank our speaker for today, Dr. G.K. Shanglu, sir, who has joined us all the way from Allahabad. Thank you so much, sir, for giving your views on today's topic, osteogenesis imperfecta. I would like to thank the presence of Dr. Jitendra Garu for accepting our invitation today. Thank you, sir. And I would like to thank each and every participant who has been online. I know it's a busy day. It's a final day of the IPL. It's a final match. I think everyone is occupied with that. But even though you have joined for the meeting, and thank you very much for being part of this oration. Thank you very much. Yeah.